This is the evaluation and management coding in-service training. These are the 10 most common abbreviations in evaluation and management. You have CPT, which is current procedural terminology. This is where all your codes come from. It's a book and what all the codes are based on. You have evaluation and management. This is a section in the code book that is for office visits, hospital visits, and consultations. You have HPI, which is your history of present illness. This is what brings the patient in at that time for treatment. You have PFSH, which is your past medical, family history, and social history. This is vital to collect. It is the history of the patient's, their medical past, medical history that their family has, and any social history that could impact their health. An example of social history would be that they only smoke on weekends when they're out with their friends. You have your ROS, which is your review of systems. This is what your doctor does when they check your eyes, ears, and nose. They are checking for things that could possibly impact your health. You have FHX, which is your family history. Family history is very important. Family history can indicate things through genetics which could impact your health. You have MDM, which is medical decision making. This is what will help decide the appropriate code to use. And this will be your SLMH, your straightforward, low, moderate, and high decision making. How much effort it takes to decide your course of treatment. You have your H&P, which is your history and physical. This is a culmination of questions asked and the exam given. You have your blood pressure, and this is the measurement taken with the blood pressure cuff on your arm, and this could show if there's a problem with the way your heart works. Then you have your BMI, which is your body mass index. This is a measurement taken to indicate if a patient is overweight or obese, and this could greatly impact somebody's health. These are the symbols and punctuation used in the CPT book. As you see, we have the symbols on the right side here. The symbols are color-coded. The revised code symbol is blue. The new code symbol is red. The contain new or revised text symbol is green. The duplicate PLA test, the category 1 PLA test, the telemedicine add-on code, FDA approval pending, the resequence code, and the modifier 51 exempt codes are all black, and the C for details symbols are all color-coded with the green, blue, and red colored arrows. The product pending for FDA approval just means that it's an experimental drug and that it hasn't been fully approved by the FDA yet. This is the evaluation and management code assignment process. Here you have the chart, and this will help you to identify the history of the chart. So on the top here you have the approach, the problem-focused history, an extended problem-focused history, a detailed history, and a comprehensive history. On the left side you have the history of present illness, the past family, medical, and social history of the 14 components of the system. Here you have to identify the exam of the chart being coded. You'll have the areas, which are the extremities, the head, back, neck, abdomen, genitalia, and chest. And then you'll have your 14 systems, which consist of the cardiovascular, musculoskeletal, the gastrointestinal, skin, neurologic, respiratory, and the ears, nose, mouth, throat. This will help you with the medical decision-making part of the chart being coded. You have your straightforward, your low complexity, moderate, and high complexities. And then here you have your minimal number of diagnoses, minimal or no data to be reviewed, and your minimal risk of complications and comorbidities. Here you will have your contributory factors if they are applicable. This will include your floor time or your minutes that you're with the patient. Here's how you would use the evaluation and management coding tool. Part 1 is the history. This is where the documentation is put of what brought the patient in. This has the onset, the severity, and other factors. Sometimes the patient will fill in the review of systems by themselves. The Part 1 and subsection A would be the HPI, the severity, the duration, signs and symptoms. Part B would be the review of systems, where sometimes the patient would fill it in. And Part C would be the PFSH. Part 2 would be the exam. This part is where it's going to tell you if it's a problem focus or the elements. This is based on the HPI. If the patient is coming in with an ankle sprain, it is going to be a focused exam. You're not going to check the head for an ankle sprain. The third part is the medical decision making. Let's use the patient from the previous slide. Part 3, subsection A, you're going to have a new problem with no additional workup planned. And then subsection B, you're going to have the review and order test from the radiology section. This and the following 3 slides will help to determine the level of risk. So for the patient with the ankle sprain, we're going to have him as a minimal risk. He's only got one limited problem and it's pretty minor. He's only going to have an x-ray and the management options are going to be some bandages, rest, maybe some crutches. He's not going to be in the low category because he's not going to need any needle biopsies or surgery. Not going to be in the moderate because, again, his problem is just a minor ankle sprain. And again, not going to be in the high category as no chronic illnesses, not going to need major surgery or emergency surgery, and he's not going to need any cardiac tests. Part 4 is going to be where you're going to put in the time. If you spent 15 minutes with the patient, it's going to go right here in the what was the total time of the examination. And then if you spent over 50% of the time with counseling and coordination of care. At this point, with this ankle sprain, you're probably not going to spend over 50% of the time with counseling. Thank you for watching my presentation. My sources came from the CPT Codebook and from these 2 websites.